The pandemic has shown us the value of bringing together population health data from multiple sources, such as patient health records, biobank and genomics data, insurance claims data, social security health data, and wearable technology data. Secondary use of health data is a powerful tool in developing and improving medicines and diagnostics, personalising the patient journey, reducing health inequalities, supporting innovation, and informing policymaking.
Think about, if you're a Minister of Health planning for your country, right, and you've got that data from different sources, then you can start to think, okay, I can predict what the population might need in 6 months' time. Or, if you're thinking as a hospital manager, you might say, well, in that case, I can see that these kinds of treatments are getting the best outcomes. So maybe this other area is where we need investment and so on. So it helps all across the health system.
But efforts to share health data across European countries are currently being frustrated.
Unfortunately, the current access to the health data is very fragmented. The GDPR offers a high protection of personal data and supports the free movement of personal data. However, the way it is implemented has led to quite a lot of fragmentation at national level, which could give an adequate image of the situation at the level of the EU.
Independent research by the Open Data Institute reveals that although there's a long way to go, some European countries are beginning to put frameworks in place to support secondary use of health data.
The lack of consistency in health data standards was a real surprise finding for us. So one of the things that we've done in this project that I hope will be really useful is we've put together, as part of our research, we looked for examples of good practice. So for each of the policy areas, we said, well, what's that country? How is that country approaching it? And if we thought they were doing something really interesting or really imaginative or really solid, then we used it as an example of good practice. Or as one person said, what can we steal with pride?
The ODI has created a tool that scores each European country on the quality of its policies and the speed at which they're being put into practice. The end result? A Europe-wide ranking that shows which nations are ready for secondary use of health data. The ambition is to give health professionals, researchers and policymakers a better understanding of the health data landscape across Europe, so together we can improve the health of future generations. Find the report and tool at theodi.org.